Good day, everyone. I'll be discussing about COVID-19 vaccination administration. So first, basic facts about COVID-19. So COVID-19 disease is caused by a novel coronavirus called the SARS-CoV-2. The virus is mainly transmitted from person to person via droplets, contact, and fomites. It is transmitted when an infected person or individual coughs, sneezes, or exhales, producing droplets of saliva containing the COVID-19 virus. COVID-19 primarily affects the lungs, but can also affect other organs. So our symptoms are we have fever, cough, sore throat, shortness of breath, fatigue, headache or muscle aches, sudden loss of taste and smell, runny and stuffy nose, and also we have nausea, vomiting, and diarrhea. So, these symptoms may appear 2 to 14 days after our exposure to the virus. So, how to protect ourselves and others? These are the 9 important COVID prevention measures. So, number 1, you stay at home and do self-isolation. If you feel unwell or not feeling well, even with only mild symptoms, you just isolate and stay at home. So number 2, you clean hands frequently with soap and water for at least 40 seconds. If not possible na makawash your hands, use alcohol-based hand rub. So for number 3, cover your nose and mouth with a disposable tissue or flex elbow when you cough or sneeze. Ngani. Number 4, no, you'd avoid touching our eyes, nose, and mouth. For number 5, you should maintain a minimal physical distance of at least 1 meter from others. So, 1 meter. Number 6, stay away from crowd and avoid poorly ventilated indoor spaces. Number 7, use a fabric mask. Wear physical distancing of at least 1 meter if not possible. Pero, if you have medical condition or high risk ka or about sa age, bata na kay ka or taas na kayo mong age or senior citizen, use a medical or a surgical mask. Then, regularly clean and disinfect frequently touched surfaces. Disinfection is very important. So, this is for preparing the vaccination site. Galang tayo mag-overview. Mo niya siya ang setup. So, we have here the waiting area. Then, we have the registration area. It takes 3 to 5 minutes ang registration area. We have the counseling and the final consent area. So, we have here 5 minutes for the screening area, 3 to 5 minutes. Vaccination area, 1 to 2 minutes. So, when we inject sa vaccine, dali ra kayo, no? 1 to 2 minutes. And then, overall, from registration to vaccination area, ang time ana is 12 to 17 minutes. For the post-vaccination monitoring area, we have here the entrance and the exit. Yeah, it takes 30 to 1 hour ang inyong stay diha sa post-vaccination area. So, I will be discussing one of them. We have here the vaccination team. In the registration area, there are two persons here sa vaccination team. Pre-vaccination area, counseling and final consent 1, screening 2, vaccination 1, and the post-vaccination monitoring, surveillance, and recording 2. Pero kung if daghan na personnel, much better. Next, so checklist or procedure in the registration. So number 1, we will ask the vaccinee to sanitize hands and get his or her temperature. So we will scan the QR code or the register ID number. Diba? Na namo atong i-discuss na ni previously ang QR code. The next, we will verify the patient's identity with any government-issued ID. Yeah, that ID contains a photo, your birthday, your signature, or even paderapod passport. So next, we remind the vaccinee to follow the minimum health standards within the vicinity. Direct the vaccinee to the counseling area. After the registration, we will have the counseling area. So next, in the counseling area, the vaccinees will be grouped at least 6 to 12 individuals. Then there will be a DOH, we will play a DOH explainer video to the group. Encourage the vaccinee to ask questions and clarifications and address issues that he or she may have. We also have to explain and to educate the vaccinee on COVID-19 vaccine, what it is, how it protects you, we will administer, and the possible side effects. Nana diha sa counseling area. So we also provide educational materials such as pamphlets or with kanang pamphlets na contain all frequently asked questions. Suitable reading level to the patient's and vaccine information statement. So, available in patient's local language para easily na ma-understand sa tao, sa vaccinee. So, we have here, as vaccinee to sign the final consent. Here in the counseling, you need to have the final consent form and you will sign it. So, for the screening, so we will take the vital signs of the vaccinee. Then may be done simultaneously with history taking. So conduct history taking. We will just focus on the present history because the past history and the comorbidities are gathered during registration and profiling. So nakakuha naman ani sa past history. So ang present na status sa patient ang atong i-ask. So ask for the following allergies, fever, if there's bleeding disorder, or any blood thinners na mga tambal, or immunocompromised, or on medicine that affect the immune system. So you will also ask if pregnant or plan to become pregnant, breastfeeding, or have received another COVID-19 vaccine. Then conduct physical exam. The physical exam sa mo na after. So for the vaccination, so we will scan QR code. So perform proper hygiene techniques to clean hands before vaccine administration. Between vaccinee and any time hands become soiled. So triple check the labels and expiration dates or beyond use dates and appearance of vaccine before administration. So i-check pag yun na ang label sa vaccine, expiration, ang appearance niya, yung noun, kung i-check pa na before na i-inject ninyo. So we will use a new needle and new syringe for each injection. So, dili na ibalik-balik. New na tanan per patient. So, perform aseptic technique. So, sterile na ang technique, ana. So, administer vaccine using the correct route, injection site, and angle as per manufacturer's instruction. So, different brands sa vaccine na ano siya different na asa itusok, unsay gamiton, asa na site. Depend na sa manufacturer's instruction. So, administer vaccine following safe injection practices. So, no na ang pre-filling of syringe and no recapping of needles. So, kani no gid need kay to also to protect the vaccinator kay ma-prick niya sa needle. So, inform the vaccinee the possible reaction after vaccination. So, balik na po na niya morning possible mga na mga reactions. Place used needles and syringe in a safety collection box following administration. So, dili ra na siya ilabay ra gid siya sa trash can. Nagyo na siya safety collection box ang kanang mga needles and syringes kay contaminated man na sila. So, document in immunization card and in the data system the following QR code and number, the vaccine lot number, expiration date, vaccinator's name, signature, date of administration, and the schedule of the next dose. The encoder of the team may help the vaccinator perform this task. So, inana ko no, dili ra na ka-inject nila mananadayon. Ilag yun ang proper documentation and butang na sila sa inyong immunization card. So, double check accuracy of information in the system and in the immunization card. So, nagtugma man na siya, i-double check. So, give the immunization card to the vaccinee. Na after na niya i-fill up ka tong mga i-document ang mga information, hatag na ninyo. Then, instruct the vaccinee of his or her next dose and schedule. So, ingnon mo when mo balik sa inyong next dose. And bring his or her vaccination card on the next schedule. So, dadun yun dapat ang vaccination card for the next schedule. Next, for the monitoring. Monitor and record the patient's vital signs every 15 to 30 minutes post-vaccination. So, i-monitor na siya. Moni ang crucial na minutes after the vaccination. So, play the OH video and provide information to the vaccinee during the observation period, and also instruct the vaccinee on possible adverse reaction and when, how, and where to report if he or she manifests signs and symptoms. So, with the signs and symptoms, adverse reaction, it will be discussed in the next presenter. So, provide information on post-marketing surveillance. Observe the patient and watch out for any symptoms of shortness of breath, syncope, kanang mapayapan ka, anaphylactic reaction, if not allergic ka, or any reaction as stipulated by the manufacturer. So, respond and give first aid to vaccinee for possible adverse reactions. AEFI or AESI will be discussed next nato na presenter. Next. So, this is the infection, prevention, and control protocol. So, vaccination post. So, ang details dapat open and well-ventilated areas, frequently disinfected areas, spacious enough to implement physical distancing, crowd control measures. Yeah, separate ang entrance and exit areas. Separate. So, also we have separate tables for each step of the vaccination procedure. Example, separate screening and vaccination areas. So also, limit number of vaccinees within the vaccination area to less than 24 individuals at a given time. So, limit yun para na social distancing gyapon. Ma-maintain gyapon nato ang physical distancing. So, for the vaccination team and composite team and other personnel in the vaccination site, so wear face mask and face shield. Practice hand hygiene before and after the procedure or the vaccine. Vaccinee. Limit contact between vaccinator and vaccinee to less than 15 minutes. So, naay limitation na contact. So, daily self-monitoring for COVID-19 symptoms. Yeah, log in upon entering and exiting a vaccination area on a daily basis. So, mag-self-monitoring mo ani after. Then, vaccinees also wear face mask and face shield. Then, frequently practice on hand hygiene. Preparing the equipment and logistics needed in the vaccination site. So we have here the waiting area. So we need single chairs, hand washing area with soap and running water, or our sanitation area with alcohol dispenser. So we also have the PPEs or face mask and face shield. For the registration area, we have computer, a QR scanner, table for each team, single chairs for the VT or the vaccination team, hand washing area also with soap and running water, or the sanitation area with alcohol dispenser. We still need our PPEs, the face mask and the face shield. So, as you can see here in the registration area, pare-pareha na siya. Ang lahi lang is the computer, the QR scanner, and our table. So for in our pre-vaccination counseling and final consent area, we need a projector or TV, counseling video that's from the DOH. Muna i-play while having your counseling and the final consent. We have also an IEC materials, katong mga pamphlets with the frequently asked questions. Informed consent form, pens, single chairs for the vaccinees. We also have table, hand washing area, and also our sanitation area, and also PPE, face mask and face shield. So next is the screening area. So in this screening, vital signs are taken. So we need the RBP apparatus, thermometers, stethoscope. We also have tables, single chairs for the vaccination team, and for the vaccinee. There's also a hand washing and the sanitation area, and also checklist, and especially the PPEs, the face mask and face shield. So in the vaccination, the vaccine and the diluent, the AD and the mixing syringes, or vaccine carriers with ice packs, safety collection boxes, alcohol and cotton, immunization cards, pens, tables, single chairs, checklists, hand washing and sanitation area, and of course our PPEs. So in the post-vaccination and monitoring and surveillance. So AEFI or AESI kit. So the adverse event following immunization or the adverse event of special interest. So nana siya kit i-discuss ni siya after my presentation. So we have also the cot bed or the stretchers, single chairs, a VP apparatus, pulse oximeters, stethoscope, ambulance, checklist, A- AEFI or AESI forms, list of referral facilities with contact details. We also have hand washing and sanitation area, and also our PPEs, the face mask and the face shield. So next, we have here the vaccination administration. So I'm sure you're very excited on this topic. So COVID-19 vaccine, which one? How do COVID vaccine work? A simple discussion lang. I will not go into details, but na lang may overview. So, we have here, depende sa vaccine, inactivated or weakened virus vaccine. Sana siya? Uses a form of the virus that has been inactivated or weakened, so it doesn't cause disease but still generates an immune response. Ano siya? Ang inactivated or weakened virus vaccine. Later on, I will discuss what type of brand of vaccine unsa na siya, inactivated, protein-based, RNA, DNA. So next, we have also a protein-based vaccine. So this one is use harmless fragments of proteins or protein shells that mimic the COVID-19 virus to safely generate an immune response. So another one, we have viral vector vaccine. Uses a virus that has been genetically engineered so that it can cause disease that produces coronavirus protein to safely generate an immune response. So last, we have the RNA and DNA vaccine, a cutting-edge approach that uses genetically engineered RNA or DNA to generate a protein that itself to respond to generate an immune response. So, mo ni siya. This is the Sinovac. Diba mo ni naabot na to ron, the Sinovac. This is the Sinopharm. This is the biotech Bharat. Ano siya, live attenuated, protein, depende na. Immune response against viral antigen, spike protein, matrix proteins, nucleocapsid. So we have here the DNA, mRNA, one mga vaccine, the Pfizer, BioNTech. This one, the Novavax. One example sa mga vaccines, one mga pictures. So, next, AstraZeneca. Nabot na po ang AstraZeneca. This one. Then, the Johnson vaccine. The Malaya or the Sputnik 5. Katong gikan sa Russia. Ano sila. Mga pictures. So, kani. COVID-19 vaccine VEP rank. So, what is VEP? Tanang mo, unsa ka ng VEP, no? That is a vaccine expert panel. So, mao ni ilang kuan. So, rank 1 is the Sinovac vaccine from China. So, unsa na iya platform. Kuan ni siya, inactivated. So, ang storage requirement ani 2 to 8 degrees ra. So, advanced market ang Brazil na o Indonesia. We're lucky na to ang Sinovac vaccine. One is siya based on the data available online November 8 pani. Mao pani gihatag sa WHO, UNICEF, and RDOH. So, number 1, Sinovac, inactivated vaccine. Sinopharma, also from China. Inactivated yapon too. So ang storage is 2 to 8 degrees centigrade. So Indonesia and Argentina. Barat or the biotech from India, inactivated yapon 2 to 8 degrees. I'm not familiar with Anwezinfi from China. It's a protein subunit 2 to 8 degrees also. So we have here Novavax, a protein subunit yapon. 2 to 8 yapon ang iyang storage requirement. So Japan, India, Canada, morning advance market commitment Manila. Then we still have FBRI, SRC vector, protein subunit yapon. So Johnson in the USA, virus vector ilang gamit. Negative 20 degrees. So, ay nakakommit na UK, USA, Canada. So, Gamaleya from the Russia, virus vector yapon sila. So, negative 20 degrees centigrade. 20 countries based on online reports from Russia, but countries not disclosed. So, AstraZeneca, morning gikan sa UK. So, virus vector 2 to 8 degrees. So, luckily, naabot na pod ang AstraZeneca nato. So, this one, I'm not familiar with this, Israel Institute for Biological Research. CanSino from China, MRA, negative 20 for their storage requirement. Pfizer, the USA also, mRNA, negative 20 to negative 80. So, very, very cold. This is ang storage. Moderna from USA to mRNA. So, negative 20 to negative 80. Corevac, Germany, mRNA, negative 20 to 80, negative 80 degrees centigrade. Inoview from USA, DNA, room temperature to negative 20. Now this one, and Andres from Japan, DNA, room temperature to negative 20 degrees centigrade. At least, natay gamay na overview anina type of vaccine and platform niya and storage requirement. So, information on COVID-19 vaccine. So, Novavax, motong protein subunit. So, 2 to 8 ang iyang shelf life. Ang vaccination site niya, upper outer arm. So ang age group na covered, adults, older adults, 8 to 84 years old. Taas iyang coverage there, 18 to 84 years old. So, route of administration, alternating IM, deltoid injection. So, there. Interval, 0, then after, 21 days after. So, two doses at 0.5 ml. Gamay ra kayo. So, type is not, is questionable and known, and also the appearance. So, Oxford, AstraZeneca, mo ito naabot na sa Philippines. Viral vector, so 2 to 8 degrees, upper outer arm deltoid, 18 years old and above. Pero wala gi-specify until kanasang above. 18 years old and above. So, route is IM. Interval, 0 to 28. So, the first day, then after 28 days. Doses needed, 2 doses at 0.5 ml. So, type and appearance, blank. So, for the Pfizer or the BioNTech, RNA and vaccine platform, the cold chain is negative 70 or negative 80. Upper outer arm, also the deltoid, 12 and above yung pwede. Then IM, then 2 doses also, 0 first dose, and after 28 days after. 0.3 ml, so gamay ra ang Pfizer na ihatag nila na tambal. Unlike sa Novavax o kaning AstraZeneca, 0.5 ml. So gamay ra gyapon kayo nagtambal. Frozen multiple doses, vials plus diluent. So white to off-white suspension before and after dilution may contain white to off-white opaque amorphous particles. So, mo ang appearance sa vaccine sa Pfizer. Next, Moderna. So, RNA ang platform, 70 to negative 80 degrees, 10 months. Upper outer arm or the deltoid. This one, all age group. Route is IM. Interval, after 28 days. Yeah, also 2 doses, 0.5 ml. Yeah, frozen multiple dose vial ang type niya. Appearance will be white to off-white suspension, may contain white or translucent product-related particles. So here, the Sinovac, inactivated to siya, then 2 to 8, 5 months, 25 degrees, go to 42 days, yeah, 37, 28 days. So, mubo ang room temperature, a cold chain niya na requirement, ang kamubo sa iyang kuan sa pag-preserve sa tambal. So, upper outer arm, deltoid, the age group is 18 to 59. Administration is IM. Yeah, 0, then 28 days after, 2 doses, 0.5 ml. So, no type, no appearance. Gamaleya from Russia, or the Sputnik 5, non-replicating viral vector, negative 16 degrees centigrade, upper outer arm, deltoid, 18 to 60 years old, IM. The interval is 0, then after 21 days. 2 doses also with 0.5 ml. So, si BioNTech ra ang katong 0.3 ml so far. All are 0.5 ml. Next, administer the vaccine. So, each vaccine has a recommended administration route and site. So, COVID-19 vaccine is given through IM. Deviation from the recommended route may reduce vaccine efficacy or increase local adverse reactions. So, mo na importante, every manufacturer na sila certain na site, route, asa dapat i-inject, unsa na pamaagi. So, a healthcare personnel should always perform hand hygiene before administering vaccines. So, fear of injection is often a reason why adults, including healthcare personnel, decline vaccine. Some of the evidence-based strategies for reducing procedural pain in children can also be used to help prevent distress and alleviate fear in adults. So, dili na siya riingon na kay dili mo doctor, dili mo nurses, madlok mo injection. Hasta kami hadlok sa injection. But then, we need to get our COVID vaccine. So, document the vaccination. So, the healthcare providers are required to record certain information in a patient's medical record. This record can be in an electronic or paper form. Healthcare providers who administer are required to ensure that the permanent medical record of the recipient indicates. So, nana dito, date of administration, vaccine manufacturer, vaccine lot number, name and title of the person who administered the vaccine, and address of the facility where the permanent record will reside. So, Kana siya tanan i-document sa vaccinator. These are the important information to be documented. So, document the vaccination. Always provide a personal vaccination record to the patient or parent that includes the vaccine, the name of vaccine administered, and the dates of administration. So, kung magpa-vaccine ta, nanataanay personal vaccination record or the immunization card. So, that would be all, and thank you.